Ms. WD is a 62-year-old female who was admitted to the ED at a small community hospital with increasing shortness of breath, dyspnea on exertion, and weight gain. She was discharged 2 weeks ago from the hospital weighing 202 pounds. Currently, she has +2 pitting edema in her lower extremities. She says these symptoms have been happening for the past 3 days. As the nurse is talking to her, she notices that Miss WD begins to become pale and cyanotic.
All right, I'm going to start by putting this oxygen on through a nasal cannula at just maybe 2 liters to start.
Okay. How long do I have to wear this?
Just until you get a little stabilized in your breathing. It'll help it ease. So
I trust you.
I'm going to put this on. With heart failure exacerbations, sometimes the workload of your heart can increase and it affects your breathing like this. And that on your finger there will tell us your oxygen level in your blood. I'm just going to take your other vital signs for some blood pressure. All right, just a little bit high. Just going to take your pulse. I'm just going to listen to your lungs. In heart failure, sometimes the extra fluid that you accumulate can end up around your lungs. Just take some deep breaths. Right, and if you can lean forward just a little bit. Right. Okay. I'm going to step out and talk to the doctors and see what they want to do next, but I'll be right back, okay? And if you need us, there's a call bell right over here.
Hey, you want to grab lunch?
Oh, I'm actually glad you showed up. I can't grab lunch right now. I'm just going over my new admissions lab values. She's a patient with congestive heart failure. She's a 62-year-old woman. I was just going to ask you, what lab results should I be concerned about in a patient with heart failure?
Oh, I'm glad you asked. I believe that it's important to monitor the kidney function tests, such as BUN, creatinine,
Okay.
because those with congestive heart failure can reduce blood flow to the kidneys, resulting in kidney damage or failure over time if left untreated. Also, I would say electrolyte levels are also important because abnormalities are a common complication in patients with heart failure.
Okay, that sounds good. Thanks very much for your help. Well, you go grab lunch and I'll catch up with you later.
All right, sounds good.
All right. Hi, Miss WD. How are you feeling?
I'm doing okay.
Okay, well, I talked to the doctors and he wants to get a weight on you, so I'm going to help you get up to this stand-up scale, okay? Just step right up. Yep. Okay, good. All right, so your current weight is 208. Do you have a dry weight that you use for your heart failure management?
Last time I think it was around 200.
200, okay. Do you know when you're supposed to weigh yourself? Or?
In the morning.
Yeah, in the morning's a good idea. You're supposed to weigh yourself every day. Usually we recommend after you take your diuretic and go to the bathroom in the morning is the best time. And do you know how much weight gain is concerning, meaning you should call your doctor?
I think it's like 5 or 6 pounds in a day.
It's actually 2 to 3 pounds. So if it was 2 to
okay.
3 pounds in a day, you should call your doctor. But that's okay. We'll go over it a couple more times with you before you leave the hospital. So, and we'll be weighing you every day here.
Okay.
Okay, so I'm gonna go talk to the doctor and see if there's any medications I need to give her, anything, and check out my other patients, but I'll be right back, okay?
Okay.
If you need anything, just ring your bell. All right. Hey doctor, I'm sorry to interrupt you, but I'm taking care of Mrs. WD, the new admission with CHF. And I was looking over her medication records, and I noticed that you prescribed her Lasix IV push.
Yes.
And I was just wondering what the purpose of giving her that drug was. I don't feel comfortable giving it right now.
Well, I actually just pulled up Lexicomp.
Oh, okay,
It's a
perfect.
good information source if you ever have any more questions about any drugs.
Okay,
Let me just get to Lasix.
all right.
Here.
Never heard about this.
So Lasix is a loop diuretic that prevents the body from absorbing too much salt and water by allowing it to be passed in the urine instead.
Okay, salt and water.
Large amounts of IV Lasix are prescribed during an acute exacerbation in order to remove all the extra fluid quickly.
Okay,
So
perfect.
that's why we prescribed it.
All right, that sounds great. I feel a lot more comfortable giving it now that I know a lot about it. And I'll definitely use Lexicomp in the future.
Sure, and if you have any more questions, don't hesitate to come and ask.
Okay, thanks. Miss WD, hi, I'm glad I caught you right before you made it into the bathroom. So I just wanted to let you know while you're in the hospital, we're going to be closely monitoring your intake and output.
Okay.
So anything that's on your tray, like a juice or milk carton or water bottle, we're going to have you saved so that we can write down the exact amount of fluid you've taken in throughout the day. Or if someone brings you in something, just let us know. And we're also going to be placing little plastic white hats in the seats of the toilet, or you could do it yourself. And this is just to catch all your urine so we can get an accurate monitoring of your fluid status. And this is very important, especially when you have heart failure or when you're receiving the diuretic medications like the doctor prescribed.
Okay.
Okay, do you have any questions?
I'll make sure to put it in.
Okay, and just leave it for after so we can
Okay.
measure it. All right,
Sure.
all right.
Hi, I'm Megan. I'm a nutritionist. Nice to meet you. So I'm here just to talk to you about a low sodium diet and a fluid restriction.
Okay.
Has anyone ever talked to about those before with you?
Well, I mean, I do try to keep salt out.
Okay. And the fluid restriction, have you ever heard about that before?
No, I usually just drink whatever.
Okay. With heart failure, we usually try to have patients do a fluid restriction of about 8 cups of water or fluid less a day. So usually you split up the day, so 4 cups of water in one part of the day and 4 cups in the second half of the day. So even with all of your meals, all of your snacks, throughout the day we only want you to have 8 cups of water. And do you exercise at all?
Take my dog for a walk.
Okay, so unless you sweat excessively with exercise, you shouldn't drink any extra water with exercise either. So just those 8 cups a day. And another thing is, even if you are incredibly thirsty, we recommend that you don't go over that 8 cups of water a day. So maybe you should leave just a few extra for the end of the day in case you're thirsty or something like that. Okay. And what about the low sodium diet?
No, I usually just use pepper.
Okay. And I know there are a lot of foods out there that say low sodium or no sodium, but have you ever talked to somebody about reading labels and stuff like that?
I look at the labels and
Okay.
I'm not sure what's considered low.
Well, low sodium, a lot of packages are labeled low sodium, but depending on the diet it's based off of, a lot of them are 2,000 calories or less a day. You just want to look out the back because it could say low sodium and be about 700 milligrams of sodium. So the recommended amount is 2,000 milligrams a day. So if you had 2 of those low sodium meals, you'd be at your maximum. So you just want to be careful and look at those labels before you buy food like that. And has anyone ever talked about salt substitutes or even
No.
homemade seasonings with you?
No.
Okay, because I know a lot of low salt food can be really boring.
Yeah.
So I actually have a list of salt substitutes and homemade seasonings that you can make and put on like grilled chicken and stuff like that.
Okay, this is great.
Yeah, I know food can get a little boring, but with those it's low sodium or no sodium. So they're great tasting too. So.
Good.
All right. If you have any questions, just contact your nurse, let her know, and I can stop back by. Okay?
Okay.
All right. Nice meeting you.
Nice to meet you. Thank you.
Hi, Miss WD.
Hi.
Hi, I'm the physical therapist.
Oh, hi. Nice to meet you.
Nice to meet you too. So you're being discharged soon.
Hopefully.
Oh, great. So do you know about any exercise programs or any home safety regarding your heart failure?
I mean, the only thing I really do is just walk my dog.
Okay, so have you ever heard of any structured or supervised exercise programs for those with heart failure? No? Okay, so basically, a lot of patients with heart failure tend to believe that a lot of bed rest is actually better for their diagnosis because they think that limited activity will minimize their symptoms and their shortness of breath. But actually, that can prove to be really harmful and can actually be worse for you in the long run. It's been proven that gradual physical activity can actually help lessen your symptoms and can improve your tolerance for physical activity and chores around your house even, especially improving your quality of life. So the more exercise you do in a gradual way, then the less chance there is that you're going to be re-hospitalized for heart failure.
That's good to know.
Yeah, definitely. So if, you should definitely look into a supervised exercise program for those with heart failure.
And where would I find?
Actually, I have a pamphlet for you that will give you some resources. Right here. So if you look over here, you can see there's a lot of exercise facilities, and they have phone numbers and people to contact, and they'll help you out with any questions.
Oh, good.
Okay.
Yeah.
Great. And for your home safety, now that you have the shortness of breath, you want to make sure that you don't exert yourself too much while doing any household activities or chores. So you might want to try moving higher shelves to a lower level so you don't have to stretch out so much and exert yourself. So it'll save more energy for you. You might also want to consider using a bath chair instead of when you're showering so that you don't have to stand up for longer periods of time. So you can sit down and shower and you won't feel that shortness of breath as often. So basically the whole point of that is so that you can maximize your activity and function independently at home, even with your heart failure. So we don't want you to feel like you're limited in any way, shape, or form. So, and if you need anything, such as a shower chair or a commode even at night so you don't have to walk all the way to the bathroom, just let us know and we can try to provide you with any sort of assistive device, even a cane or a walker if you feel you need extra help getting around the house. Okay?
Thank you.
So any more questions for me?
I think that was a lot, but I think I got
Okay,
it.
if you need any reassurance or anything explained again, just tell your nurse and I'll come back in and we can go over it again.
Okay.
Okay?
Yeah.
It was nice meeting you.
Thank you. Nice to meet you.
Yep, good luck.
Hi, Miss WD. How are you feeling?
Okay.
Okay, good. Well, I just wanted to come in, and now that you've spoken to a lot of the people in the hospital, I just wanted to give you this pamphlet and this little booklet, which is all about heart failure. So everything that we've gone over with you throughout your stay so far is in it. And if there's any questions that aren't answered, I or the nutritionist or the physical therapist or even the doctor will come in and talk to you about it, answer any questions you may have. Also, right on the inside here, there's the phone number for the hospital, and it just reminds you of quick signs and symptoms in case this should happen again for you to call 911. Okay?
Yes, thank you.
All right, well, it was very nice to meet you. My shift's over, but I'll be heading out and I'll be here tomorrow morning